At the outset, I thank the TAMILNADU RSSDI team, Dr. Balamurgan sir and the team for making me a part of this conference. So sugar's deadly legacy, the diabetic epidemic. So I'm just taking through the simple aspects of diabetes, how the things are going on in India and across the globe. That is what we'll be discussing. Greetings to all of you from Bangalore. So this will be the table of contents. So we all know the diabetes varieties are there, but how the things are going on across India, across the globe, this is what we are worried, why it is being spreading like an epidemic. So it is spreading like a tsunami across the globe, especially in our country. So diabetes is becoming the biggest epidemic of the 21st century. It is the fourth leading cause of death in developed countries. Complications like cardiovascular disease is 50 to 80% of diabetes related deaths. Peripheral vascular disease, stroke, neuropathy, amputations, renal failure and blindness. And we know the diabetic neuropathy is the most common complications. Retinopathy is the major cause of blindness and visual disability. After 15 years of diabetes, 2% become blind, 10% develop severe visual impairment. Kidney failure is among the leading cause. Severity varies by population and disease progression. So around the world, if you take the diabetes around the world in 2021, 537 million, approximately, are living with diabetes. 643 million by 2030, that is the total number of people living with diabetes is projected by 2045. 3 in 4 adults with diabetes live in low and middle income countries. So 830 million worldwide have diabetes. More than half of the people living with diabetes are not receiving the treatment. This is a major concern. 3 in 4 adults with diabetes live in low and middle income country. People with diabetes and the number of people with untreated diabetes have been steadily increasing over the past decades. So what are the population at risk? You can see across the globe, starting from the left hand side, by projection is between 2021 to 2045, there is a 24% increase in North America and Caribbean. In South and Central America, it is by 50%. In Africa, you can see that it is increased by 134%. In Middle East and North Africa, it is increased by 87%. Western Pacific, it is increased by 27%. Southeast Asia, where we come, like it is 68% increase, and Europe is more 13% increase. So it is not only in India, across the globe, the diabetes epidemic is going on and it will keep on increasing. So we need to take action about this so that this disease can be halted. So overall and area-wise weighted prevalence of diabetes and pre-diabetes, if we see in this study, that is ICMR India National Cross-Sectional Study, reported the overall weighted prevalence of diabetes as 11.4% and pre-diabetes as 15.3%. The maps you can see on the right hand side illustrate the prevalence of diabetes and pre-diabetes across different states in India, categorized by overall urban and rural population. So diabetic prevalence in IA is highest, that is more than 10%, as seen in the graph, in states like Maharashtra, Karnataka and Tamil Nadu, particularly in urban areas, whereas rural areas have lower prevalence. This is a 2-year back study. So the pre-diabetes is widespread, with many states showing a prevalence of more than 15%, indicating a high future risk of diabetes. So if you see the exploring diabetes epidemic in India, the bar graph shows the increasing prevalence of diabetes from 2000 to 2017, with the case rising from 32 million to 73 million. A sharp increase in projected, with an estimated 134 million people affected by 2045. You can see on the extreme right that how the sharp increasing happening from 2017 to 2045. So the trend highlights the growing burden of diabetes, emphasizing the need for preventive measures and effective management strategies. When it comes to age-wise incidence of diabetes in India, you can see it can be seen from 10 years up to 60 plus. As the age advances, as shown in the graph, the incidence of diabetes, it goes on increasing. You can see by 60 plus, you can see approximately 35% of the incidence of diabetes is seen in India. If you see the comparative diabetes prevalence, India versus the global, you can see from 2000 to 2025 year, you can see the India is far higher compared to the global average. So India is spreading like a major epidemic in our country. So the global versus Indian trends, higher type 2 diabetes prevalence among Indian youth compared to Western countries. South Asians are more insulin resistant due to genetic predisposition, urbanization and increasing obesity rates contributing to the epidemic. So diabetic projections and the key drivers. Diabetes projection is, like you can see, by 2025 is 1 in 8 adults will have diabetes, that is 46% increase. Type 2 diabetes, more than 90% of the case influenced by socio-economic, demographic, environmental and genetic factors. You can see in the bottom the key drivers for type 2 diabetes, that is urbanization, aging population, reduced physical activity, rising overweight and obesity rates. We know the traditional complications of diabetes, that is diabetes kidney disease, retinopathy, peripheral neuropathy, coronary heart disease and heart failure, stroke and peripheral vascular disease. So what is the burden? You can see this slide, next few slides I will be talking about the global burden and the Indian burden. When it comes to macrovascular disease, it is around 20 to 30% globally. When it comes to microvascular disease, retinopathy is 35%, nephropathy is 30 to 40%, peripheral neuropathy is 30 to 50%. See, this is the global prevalence. Now, when it comes to Indian prevalence, like, are we any different? Yes, we also see the macrovascular disease is around 25%. Microvascular diseases like retinopathy is 18% to 25%, nephropathy is 20 to 40%, peripheral neuropathy is 26 to 35%. So the traditional complications of diabetes, cardiovascular complications is the leading cause of death in diabetes, affecting 30% of type 2 diabetic patients and responsible for 50% of diabetes related deaths. Key issues are atherosclerosis and heart failure. So what are the emerging insights? That is exophers, which helps the cardiomyocytes dispose of damaged mitochondria. Dysregulation contributes to complication. Novel therapeutic targets include QQI7 protein epigenetic pathways and nitric oxide signaling. When it comes to diabetic kidney disease, it affects 30 to 40% of diabetic patients, responsible for 30 to 47% of end-stage renal disease. Pathophysiology, we know that key changes are the podocyte dysfunction, glomerular basement membrane thickening, and glomerulosclerosis due to excess ECM protein. When it comes to emerging therapies, the promising target is latent TGF-beta 1 and ceramide 1 phosphate to address fibrosis and lipotoxicity. Next, when it comes to retinopathy, it affects up to 45% of the diabetic patients with early pericyte loss, causing vascular instability and blood-retina barrier disruptions. The key drivers are hyperglycemia and VEGF-1 signaling leads to vascular leakage and disorganized neovascularization. Next is the inflammation and oxidative stress. What are the emerging insight? Biomarkers like SEMA4D predicts an anti-VEGF therapy response. Circular RNase that regulates the vascular health by modulating signaling pathways. The therapies, DPP4 inhibitors and the protective lipids like omega-3 fatty acids show potential benefits. When it comes to neuropathy, it affects about 50% of the patient. What is the mechanisms? It activates the polyol pathway, depletes NADPH, GCH and generates AGs and impairing nerves. Ion channels, dysfunction of sodium 1.8, HCN2 and TRPA1 causes hyperalgesia and allodynia. The most important is the neuroinflammation. When it comes to the emerging insight, genetic risk, insulin resistance and Schwann-Schell dysfunction. Now this is one important aspect, that is what are the emerging complications of diabetes mellitus. Like one is the cancer, infections, liver disease, functional disability, cognitive disability and affective disorders. Because the bottom line is the most neglected things we tend to forget in our day-to-day busy practice, which has to be addressed. So if you see the